During the past years, there have been more cases of HIV in Texas, especially in the El Paso region. While the state and El Paso County continue to make efforts to control HIV in the area, more cases are being reported to local authorities. Even though the city of El Paso offers its residents free services such as anonymous HIV testing, many people are still unaware they are infected. If this continues, there is a greater risk of having other people being infected by those that are infected. HIV is becoming a problem in our community, and we must do something about it. So what is HIV?
HIV/AIDS has taken the lives of over 39 million people worldwide, despite our efforts to prevent, treat, and better understand it. But with 35 million people currently infected, what exactly is it, and are we close to a cure? To contract HIV, the virus must enter the bloodstream, and it's often transmitted from infected bodily fluids like blood, semen, vaginal fluids, or breast milk. Once inside the bloodstream, HIV targets a variety of cells, but most specifically the T helper cells, which are a type of white blood cell that play an essential role in our immune system and fighting infections. The outer envelope of HIV is covered in glycoproteins which mutate frequently, ultimately tricking the T cell receptors to not recognize the virus. Once attached to specific proteins on the T cell, it begins to fuse the membranes together and eventually enters the cell where it releases 2 viral RNA strands and 3 essential replication enzymes. Because HIV is a retrovirus, the RNA is transcribed into DNA, represented here by a zipper of 2 RNA strands transcribing into DNA. This DNA is then integrated into the host cell's genome. This makes the T cells treat the viral genes like their own, which causes them to make more copies of the virus. These then leave the host cell and mature, ultimately seeking more T cells. The virus is particularly difficult to treat because its mutation rate is so high. Overall, the replication process creates more than 10 billion new virions each day. During these initial stages of replication, called the latency period, a person may not show any major symptoms for up to 8 years. If not treated, the HIV eventually kills off the specific T cells it infects. When these T cells fall below 200 cells per cubic millimeter of blood, it becomes acquired immune deficiency syndrome, or AIDS. After progressing this far, the immune system becomes suppressed and is much more susceptible to cancers and opportunistic infections such as pneumonia. A person doesn't die from AIDS, they actually die from an illness that the body could not fend off. Nowadays, there is medicine that helps fight these opportunistic infections, like Daraprim, which was recently in the news when Martin Shkreli of Turing Pharmaceutical decided to raise the price from $13.50 to $750 per pill. There are also antiretroviral drugs that slow the virus down by blocking certain enzymes which are required for the virus to multiply. Similarly, those without HIV but at high risk of contracting the virus may take pre-exposure prophylaxis, or PrEP. This works similar to antiretroviral drugs by blocking the enzyme reverse transcriptase. Thankfully, there is hope for a cure. A small population of people are immune to the HIV virus because of a mutation linked to the T cells. In one case, an HIV-positive subject received a bone marrow transplant, meaning they were given new stem cells that generate different T cells, and within 20 months, there was no evidence of the virus in their bloodstream. Though this is very individualized medicine, it certainly opens up the possibilities of generating HIV-resistant cells. Combine this with other therapies and preventative measures like condoms, clean needle programs, and safe blood transfusions, and HIV/AIDS may one day be a thing of the past.
As the video stated, there have been many advancements in the search for a cure for HIV. The newest and most successful is the bone marrow transfusion from an HIV-resistant donor. So this test is extremely new and not many people have done it. The bone marrow transfusion has successfully cured 3 people. There are 3 well-known tests that you can take to see if you are HIV positive. One being the nucleic acid test, which analyzes the blood to see if the virus is present. The results can either be positive or negative. The test is not routinely used due to the costs, yet it is highly accurate when it comes to possible early exposure. Another test is the antigen antibody test, which looks for antibodies against the HIV virus, the immune system produces antibodies in response to bacteria or viruses like HIV. If you have HIV, then the body will produce an antigen called P24. The most commonly used are the laboratory-based tests. These tests look for antibodies generated by the immune system against HIV. One lab-based test is the rapid antibody screening test. Results are ready in 30 minutes with just a prick of the finger. Another test is the oral fluid antibody test. For this test, you need to swab the mouth and collect a fluid sample. You can get this test done at the clinic, but can also be done as a home kit. If you choose to take this test at home, it is great for confidential results and provides instructions on what to do after results. Lastly, the home collection kit is a pricking finger test. After completion, the sample is sent to the laboratory. In this case, the individual is anonymous. If the results came out positive, they will further instruct the individual to go to a healthcare provider for further testing.
But why are people not getting tested? They have all the tools available to them and they are even free and confidential. But studies have shown that due to the stigma associated with HIV, people are not getting tested because they are afraid to be identified as an HIV positive patient. Alex Gardner, an HIV activist, once said, "One of the best ways to fight stigma and empower HIV positive people is by speaking out openly and honestly about who we are and what we experience." This quote is a beautiful quote because it's imperative we break the stigma of HIV that many individuals face and promote the practice of treatment and recovery. On a daily basis, people are fighting to stay strong in their journey to recovery as an HIV positive patient. So don't let the stigma to HIV beat you. Break the silence and get help. There's HIV support groups that help others get through this dilemma. Now, although HIV currently is not a curable disease, there are treatments available to allow you to live a normal life with HIV. So we urge you, go to a doctor and get on a treatment regimen. Lastly, help us with our goal to prevent HIV by getting tested at least once a year. Use preventative care measures and educate others about HIV. Help us spread the word.
No one is getting tested in the fear they may get a positive result. Many people are unaware of the infection, and 1 in 8 people don't know they are living with HIV. People don't know they have HIV until they feel sick and the symptoms are similar to the flu. They only last a couple of weeks and then go away. The next visible time is around 10 years when people begin to develop sores on their skin. By this time, it's already too late.
Here in El Paso, the numbers of HIV cases continue to rise. El Paso County is number 6 in the state of Texas for HIV diagnosis. It is not surprising that El Paso is so highly ranked in Texas because of the size alone. However, with the tools and prevention strategies employed by the Department of Public Health in El Paso, we should be seeing less cases. Yet, this is not the case. We are seeing more new HIV diagnosed patients. In 2016, there were 93 cases reported, and it was known that in El Paso there were 2,061 people living with the virus. In El Paso County, 182 people were diagnosed between the ages of 13 and 24. 284 people have been diagnosed between the ages of 25 and 34. So roughly 450 people who were diagnosed were of college age. We as college students think that UTEP should consider furthering the education of HIV and should raise awareness, since UTEP students fall under the ages that were mostly impacted by HIV. In order to reduce the rates of HIV, a community must have preventive strategies and offer clinical services to those who are affected or want to reduce the risk of having HIV. It is important that all our citizens are well informed of the different places where they can get tested and find interventions that aim to halt the transmission of HIV. The following sites are HIV programs that provide prevention messages directly to a person at risk, assistance to obtain prevention services, and encourage patients to reduce risk. The M Factor is an innovative, dynamic, and fun group focused on empowering young gay and bisexual men to make healthier choices. Another organization is the Purple Pages of El Paso. This organization connects LGBTQ individuals and families in the Paso del Norte region with high-quality, culturally sensitive healthcare and social services. There are also clinics like Centro San Vicente Clinic that provides patients with advice on providing PrEP and determining if it's the right move for them. HIV affects everyone, not just the gay community, and we think that having this clinic is a step forward in neutralizing the disease. Also, the Department of Health offers free confidential testing for ages 13 and up without parental consent. HIV is rising in numbers for people who don't have access to healthcare easily. That is why it is important that we spread knowledge of the free testing and information that is available in our community.
Knowledge is power, and our goal is to spread information about HIV awareness and prevention here at the University of Texas at El Paso. Since the vast majority of people infected with the virus are of college age, starting at UTEP will allow us to educate the population of our community who is at higher risk to get infected and spread the virus. To inform students about HIV, we have created a brochure to pass out around campus. This brochure will give insight as to what HIV is, HIV cases in El Paso, the stigma surrounding HIV, clinics that provide HIV testing, and crucial steps in preventing HIV.
In order to ensure that UTEP students are aware about the HIV epidemic outburst, we will educate students about HIV and how to prevent its transmission. By providing information and resources here at UTEP, we will be able to inform students without discriminating and stigmatizing certain risk groups. Along with the brochures, we will pass out flyers with content that provides facts and myths about the disease. As UTEP students, we pay a medical service fee each semester, which entitles us to a variety of student health services. The College of Health Sciences Student Health and Wellness Center website gives us a list of services that are provided. Many services are provided, including confidential STD testing. UTEP does host an annual virtual listening session once a year about STDs, but this is not enough. So many students have no idea about the services that UTEP provides, and that is part of the problem. Along with the brochures and flyers, we want to provide information sessions about HIV on campus so that the students know of all the possible options to get help, tested, and learn more on how to cope with or help someone cope with HIV. El Paso County is one of the highest ranked counties in the state in regard to the number of people known living with HIV. The number of HIV cases in the El Paso community are continually rising and are most predominant among college students. Most of the people who have the virus in El Paso are a part of, but not limited to, the LGBTQ community. So, it is essential that everyone who is having unprotected sex or injecting drugs needs to get tested. Though HIV can be spread in a numerous amount of ways, the number of cases found in our community could dwindle if knowledge about the virus and how to prevent it were more known. The resources for HIV prevention in the El Paso community are available, but many college students are unaware. Providing knowledge, answers, and resources to our UTEP community will help diminish the stigma that surrounds HIV. By getting this message across to our fellow UTEP students, we can reduce the amount of people in our community that might become infected or transmit HIV.
Together.
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 Here at UTEP, we can help stop the increasing spread of HIV